After I finished my first year of medical school, I went off and did officer training school. And then after I completed medical school, I was promoted to captain and went on to do my OB/GYN residency at San Antonio Military Medical Center. And it's just really been a fantastic opportunity. Being able to serve the men and women who serve our nation and their families and provide them care is just really something special. That is care that they really deserve for everything that they sacrifice for our nation. And it's difficult for those families. Sometimes they've traveled all over, so their families are maybe on the other side of the country, or their spouse is deployed to another country. So being able to support them and be in their corner and cheer them on through labor and just the difficult aspects of pregnancy, or maybe not even pregnancy, but just a difficult gynecologic issue that they're dealing with. So it was really rewarding. I'm really grateful for that experience. I really enjoy being able to provide full spectrum general OB/GYN care to my patients, but a special aspect of my training, I think, is getting to work with the Army and Air Force midwives and participate in their deliveries and the care of their patients as well. I was able to learn some tips and tricks about freedom of motion in labor and how to really optimize that experience for our patients without medicalizing their birth. And so that is kind of a unique thing that I have to offer my patients. It is really special for me to be able to come back to Fremont. I had always dreamed of becoming a doctor ever since I was a young girl, and part of that dream I thought about was serving my community, and that was part of what was so appealing for me. You know, it really does take a whole community to raise our children and to help us shape the people that we become. And Fremont's always been a special part of my life and definitely shaped who I've become. So to kind of go through this whole journey of medical school and residency, being away from the military, and to finally be able to come back home and provide that care for the women of Fremont and the surrounding community, I just really couldn't ask for a greater purpose. So it's really satisfying.